Okay, well, Nate asked me to kind of do a little demonstration on how I use learners in telehealth and telemedicine, and how we can actually utilize the tools of telehealth and telemedicine to kind of advance the learning and also teach our learners how to do telehealth. So that's kind of what I tried to put together here, okay? So I wanted to expand the use of telehealth clinics as a platform for resident education and also non-resident education for some of our students also. Increase learning opportunities for students, residents, and fellows, and use this during our COVID time and also prepare them for the future of telehealth themselves. Outline some of the limitations and sometimes what the limitations are on an in-person visit. Then demonstrate some of the useful ways to leverage telehealth in the learning environment. So for virtual clinics, we use a Zoom platform. I think it's very helpful because most of the parents and families already know how to use Zoom because of at-home schooling. And so I found that they've not had a huge issue getting in and navigating it. Most public schools and universities have this already. You can get access via children's license, or you can get it via licenses over at University of Nebraska Medical Center. We use the attending's personal meeting ID and just forward that number to the learners because that's the same way that we ask the parents to get into their sessions too. So trying to put it together and having a game plan that you're going to use based on the learner is helpful. So if you know you're going to have a resident with you for that day, kind of setting their expectations of, yeah, why don't you try doing pre-charting on some of the patients so that you get to know them, really to have them figure out who they're going to be with and have them add the attending to their default schedule is very helpful. If they've never done telehealth before, I think having them watch a couple of visits or walking through some of the things that you want them to do would be helpful. So like on students, I might do it a little bit differently and say, okay, why don't we do the review a systems piece, or do the past history, or maybe take just a short history of present illness. The nice piece is that you get a provider basically in the room watching the performance of all of these tasks that you otherwise sometimes wouldn't get in an in-person visit. You can use that opportunity to have clarifying questions and actually model kind of some of the questions that you would want the learner to demonstrate and to learn. So some of the planning tips that I usually recommend is a lot of times the residents or the learners don't know how to get to your schedule. And in Epic, everybody has a schedule screen. If you go to the default schedule and then you add in the provider. So like in my case, I had Lauren Zent go in here and say, just add me, just add provider, all departments, and then select my name. That gets them all the patients that you're going to be seeing, no matter what variants of department you're in and what subclinic and all that type of stuff. That's been actually very helpful. And then we invite the learner into the visit just like we would invite a family into it. It's been easiest to do that via an Outlook meeting request with the Zoom link to your PMI. And it informs the learners of everybody else that's involved in the clinic. Like I'll send that same invite to my nurse, or I'll send it to a scribe if I have a scribe. What you have to tell the residents on the other end or the learners is that it's going to be optimal if they're on a laptop. The laptop has a built-in camera and has built-in speakers, and it gives them kind of something right out of the box ready to go. And the children's ones and the UNMC ones, like I said earlier, both will have the ability to do Zoom, and so it shouldn't be too much of an issue. So some of the tips for success is verify patient identity at the onset of the visit, and then go ahead and introduce everybody. And that's kind of the attending's task there. It's also nice that everybody has their correct label of their name on the bottom of their picture, so that it doesn't just say iPhone or something like that. And then consider having like a telehealth slide deck or a little PowerPoint presentation with some things that you're typically trying to teach on. And I'll show you a little of those in just a second. Utilize share screen and educate patients and the learners when possible, like viewing x-rays, lab studies, things like that. This is the slide deck that I start my screen with, and it can really get people up and running pretty quick, where I'm like, okay, I can't hear you, do this stuff, and instead of me trying to tell them and they can't hear me, they can just read the screen if I share the screen with this type of a slide deck. I also have things like this on my slide deck and a little education pieces that I really use for sleep apnea, allergies, and respiratory issues. These are some of the things that I'll actually share with them, like their sleep study results, and I can walk through it and they can get a really good idea of what we're looking at, x-rays, downloads from their CPAP machines, but really you can share anything. I know some people use whiteboards too, and will draw out like what their planned surgery would be, or things like that too. The exam is the most difficult portion in my mind, because I can't get the camera to do everything. When you are doing the exam, though, I usually instruct the residents or the learners to really verbalize their exam. What this does is it allows me as the, as the educator on making sure that they are seeing what I'm seeing, and I could also basically type into the exam in the note what they're saying too. So then we create an efficiency in that regard. It does also help the parents or the patient know what you're seeing, and they can provide a little bit better feedback. They're like, well, actually that tape on there, it's not a rash, it's just some excess tape on my stomach, or things like that. And then I'll just walk through, like, eyes are clear, I don't see any runny nose or rhinitis, looks like there's no nasal congestion, and things like that. It also helps us know what the learner's assessment of the exam is, and then we can provide clarification if we see something that they didn't verbalize out. So telehealth, you also get to peer into what kind of the patient's home looks like. Many times the video quality is not that great, but it also gives you the opportunity to make sure that the patients can demonstrate how to take their medicines, or that they have their medicines, and it also gives you kind of a little home assessment. So there are some benefits of doing a telehealth. On the telemedicine side, we do have peripherals like otoscopes, ophthalmoscopes, digital stethoscopes, and this is a demonstration of the echo stethoscope that we're going to have in Kearney, where you can actually visualize the sounds that you're hearing and get an EKG at the same time, and that's all done remotely. This is an example of a otoscopic view of the new cameras that we're having, and I can probably see more and can get a snapshot that allows me to do a little bit further inspection on an eardrum in a kid that I otherwise wouldn't. This is a good camera picture of an exam of the pharynx, and then this is the dermoscope camera that will give you close-up views in high detail. So the telemedicine peripherals are very helpful, and it helps bridge that gap between, you know, a good exam piece that you can get through it, and the benefits of telehealth where they don't have to travel as far. So ending the visits, I usually try to review and educate with both the family and the learner. And I try to engage the learner on aspects of the case after the visits. And sometimes I find that there's actually more time during telehealth because we were in the room together, and it's not this piece that you go in and then I come in, and it ends up being a much longer visit. In telehealth, you keep that contracted visit, and you're taking up portions of it all at the same time, so it's all in conjunction. But again, delineating the learner's responsibility and expectations, you know, either at the start of the visit or at the end of it, and say, okay, this is one of the patients. If you can kind of go through and kind of summarize what we said, if there's anything that you want them to research on or find out further in regards to that case, then lining those things out. Okay, and then I have another short video of what it looks like too. So Lauren Dent helped me kind of do this, and we took just a quick little picture of one of the visits after I got consent from the parents to do that. So I'm just going to play this back and kind of see how it all happens in real time.
These are where I have everybody kind of set up on the videos, like I'm right here, resident right here. Thanks Lauren for helping out. My nurse is in here, and she's kind of listening on as we go. Lauren, what I'll probably have you do is just kind of ask them kind of those HPI questions like we did before. I'll kind of introduce everybody to begin with, and then I'll let them know that we're just taking a quick video of everything, okay? I'm gonna get started. I'm Dr. Burg, and I think we're seeing Carter today, is that correct? Carter, can you raise your hand and make sure that you can hear me okay? Good. Okay. I have a few people here with me today. Lauren's a resident that's going to ask you a few questions. I have Diane, my nurse, that's on. And then I have Amber, a scribe that's working with me today. Okay, go ahead, Lauren.
Okay, well, nice to meet you. Hi, Carter. Your dad?
Yeah.
Okay. And so it looks like last time you saw Dr. Berg was in February, correct?
Yeah.
Yep, okay. Any concerns or changes since you guys last spoke?
Let's talk a little bit about your CPAP also. I'm going to share your screen that we get from your download from your CPAP. And so, you know, when I would look at this, I'd like to see a bunch of green bars all the way across here. And I see, you know, kind of sporadic red ones and a lot of nights of not using CPAP. I'm going to let Lauren kind of go through the exam with you. And just, Lauren, as you kind of do it, just talk it out loud so we can take notes as we go, okay?
Yep, okay. So if you can come as close as possible to the screen or the camera for us, Carter, that would be great. Okay, so I'm just gonna talk out loud. Might sound a little funny, but head looks normocephalic, atraumatic, external ears. Can you turn your head either side? Okay, good. I don't see any exudate, no erythema, moist mucous membranes. Okay, good.
It is a little narrow in the back of his throat there, so he does have kind of a narrow posterior pharynx. Okay. Tongue size looks good, and your palate looks nice and normal in contour. All right, any questions, Lauren?
So with the narrow nares,
yeah.
And then if he's not using his steroids, that's gonna kind of constrict his airway, and then narrow posterior pharynx.
Yeah, so let me share my screen with you too. So like if he's got swelling in his nose just from nasal congestion, that contributes to. This is the setup that Lauren has kind of in her side of it, where she just has kind of a laptop that has the camera and allows her to kind of see the screen sharing and get onto.
Okay, I think that is kind of the demo. I hope you guys can hear it okay, but it works pretty well. It allows me to kind of give feedback and kind of educate both the parents and the learners at the same time.
Chat. Next.
Thank you.